Why do nurses quit nursing? We go to school sometimes for 2 years, sometimes for 4, sometimes for 6 or 7. What happens? Where do things break down that make us give up a reliable job and a pension and benefits and, the glory of being in the most trusted profession in the country? The reality is there are lots of good reasons why nurses leave nursing, or why they leave conventional nursing and go into something a little bit different. Let's break all of these down, right? I've got six reasons why nurses leave nursing. The first reason why nurses leave nursing is because of burnout and lack of time or energy for their own self-care and well-being. Nursing is a demanding profession. Whether you're inpatient or outpatient, whether you're a new grad or a seasoned nurse, you're in leadership, it takes its toll. We work long hours with incredible physical demands, incredible emotional demands. When we work these long hours, there's little time for rest or self-care. Oftentimes with the short staffing, a lot of nurses can't even take the vacation time or the leave time that they've accrued, that they've built up, because who's going to cover them? They've got to have enough nurses on the floor or in clinic. We also feel a lot of stress when we're doing something where we don't feel competent in it or good at it. Maybe we're putting in an IV for the first time in a really long time, or the patient's got wormy veins and they're really sensitive. That creates stress. We've got, other practitioners. We've got the doctors whose opinions matter more than us as nurses, even though we might have more experience and expertise in that field. And I'm going to talk more about that in number 2, hint, hint. When you think about the physical strain of nursing, now we often have overhead lifts to move patients, but how many of you actually use your overhead lifts? How many of you actually do 2 nurses to move a patient, or nursing assistants, right? It's not only the RN who's impacted, it's also can be the LVNs, the NPs, NAs, all of us can be impacted by that. When we don't take care of ourselves, we can't take care of our patients. So important that we prioritize our own self-care. Nurses have really high rates of breast cancer. Night nurses have even higher rates of breast cancer. Why is that? It's really hard to prioritize our sleep and our well-being if we're not getting sleep and we're not able to give ourselves time for that care. So that's one reason why nurses leave the profession. Now, if you're feeling like, girl, I don't even know vitality, what is that? I haven't felt vitality since 2012. I've got your back. Head over to my website, divinelyjennifer.com. Get signed up for my mailing list. I've got all sorts of freebies for you, tools, some tricks here and there. I'll teach you how to find that. I'll teach you how to prioritize your self-care so that you can take care of your patients and you want to show up for work every